Welcome back. In my first video, Healthcare Advocate, I discussed flaws in the self-insured health plans which are causing companies and their employees to overpay for health care. I mentioned that employee hospital claims are paid from summary bills, which do not provide an itemized list of the charges. Under the current system, it's impossible to tell whether or not your hospital bills are accurate. Now I'd like to address the problems of unknown pricing and the complete lack of enforcement of Sarbanes-Oxley as it pertains to healthcare costs. Believe it or not, most chief financial officers don't even know what their companies have agreed to pay for healthcare. In fact, many TPAs refuse to disclose the prices that their clients pay for healthcare. The pricing is deemed confidential. How can a CFO be sure that your hospital bill is correct if no one in the corporation knows what the prices are supposed to be? Another billing problem involves inconsistent pricing. This is particularly common in inpatient pharmacy category of hospital bills. When medications are provided to hospital bills, the prices may vary by 650%. Let's look at a real-world example. If you're not in a corporate self-funded health plan, Trinidad costs $1.44 a pill. But if you're in a corporate self-funded health plan, same pill, not $1.44, $108.40. But you get a 20% discount. After the discount, your employer is being robbed $86.72 a pill. And with your 20% copay, you're paying $17.34. $108 a pill, $1.44 a pill. In other words, you're being charged a $17.34 copay for a pill that the hospital sells to other patients for $1.44. The bottom line, you're being overcharged at $17.05 a pill. At this point, you're probably thinking, there must be a law to protect me. The Employee Retirement Income Security Act, ERISA, protects the interests of people in employee benefit plans. Now consider this. Under the current system with self-funded corporate health plans, they're routinely paying bills without confirming the accuracy of the charges. As a result, employees and retirees like you are overpaying for health care. The law simply hasn't been enforced as it applies to employee benefit health plans. The Department of Labor has prosecuted fiduciary breach cases in pensions, but it hasn't actively pursued fiduciary breach in health plans. A second piece of legislation designed to protect you is Sarbanes-Oxley. After the accounting scandals at Enron and WorldCom, the Sarbanes-Oxley Act was passed to ensure corporate accountability. Corporate officers are required to verify the accuracy of their company's financial reports. They must sign SEC documents indicating their company's accounting systems are adequate. Unfortunately, the Securities and Exchange Commission has completely failed to enforce Sarbanes-Oxley as it pertains to employee benefit health care accounting. Corporate officers are certifying their accounting systems are adequate, but no one knows what the correct health care prices are for your health care. No one's reviewing the billing detail for employees' hospital bills. In other words, the law's in place to protect you, but the law isn't being enforced. If you bump into your congressman or congressional candidate from either party on the campaign trail, you might say, isn't it time to enforce Sarbanes-Oxley? Finally, I have 3 things you can do to reduce your health care costs. Again, this applies to those of you that are employed by a publicly traded corporation with a self-funded health plan. 1, if you've been hospitalized, call the hospital and request an itemized bill. If you don't receive it within 7 days, send the hospital a certified letter requesting the bill. 2, send your employee benefits manager a certified letter requesting a line item review of your hospital bill. The review should be performed before the explanation of benefits is sent to you. 3, after your bill has been reviewed and after you've received your explanation of benefits, contact your benefits manager. Explain that you'd like to make an appointment to review the prices that your employer has agreed to pay for the healthcare goods and services that have been provided to you. These 3 steps will reduce your healthcare costs and will dramatically reduce the cost for your employer. Next week, we're going to talk about healthcare refunds. Thank you.